Fertility Season 4. This morning we are welcoming Alex Smith, a fertility and hormone health coach with a special interest in PCOS and endometriosis. Alex has her degree in physiology, which includes endocrinology, nutrition, and biochemistry. We are so excited to learn more about what Alex offers her clients as well as her own personal story. Welcome, Alex. Thanks for joining us.
For having me.
We are so excited. We are so excited you're here, especially because I saw that you specialize especially in PCOS and endometriosis. And I know our listeners, there's so many people that have been diagnosed with that. So I think it's going to be really helpful to hear from you.
Oh, good, good. Yeah, that's what I'm here for, to help people with them conditions and people who are just struggling with their fertility as a whole, unexplained infertility too. So yeah,
And it's such a special niche, not for the three of us because we're all consumed by it. But how did you get into the fertility world and working as a fertility coach?
So there's probably two things now when I think about it. So first thing is so for myself when I was trying to conceive, it didn't take a massive a long time, but it did take time. And I think at first, when you first try to conceive, you think it's just going to happen straight away. So, I went to the GP, the doctor, to do some more investigations, and I ended up having like a laparoscopy. And when they did that laparoscopy, they found endometriosis then. And then you also just flushed my tubes and all that type of thing. And I think back then there wasn't a lot of education on the likes of endometriosis. You were just told, and then you walked away, and you just didn't think much about it then. And thankfully I did conceive my daughter and my son. But it's just that whole, back then wasn't spoken about. And then what happened was when COVID hit, a lot of people then reflected a little bit on their own sort of careers and that type of thing. And I then went and did went to do a health coach diploma for 12 months and then specialised more so in hormone health for another 6 months, and then started to take clients on. And when I was working with clients, it was just for general health, hormone health. And as I was working with them with these specific conditions, especially the likes of endometriosis and like even adenomyosis, um, the things that we were putting in place were helping them, and women were starting to get pregnant as well because of some of the changes they were putting in. And it just sort of really um pushed me towards helping these women a little bit more with what I was doing. So that's when I started to niche down into the fertility space. And then that was like about 4 or 5 years ago now, and I've just continued to um help them. And I think it's also down to probably myself with my own endometriosis as well, and just being there for people to support them on their journeys.
I love that. And so it sounds like a lot of it is with nutrition, and obviously want to hear some different things, but I think that's just like so hopeful for listeners listening if they've had an endo diagnosis or if they've been told that they have PCOS, and not that like they necessarily have to have like this super invasive surgery to clear it, but that there might be some like holistic approaches. Do you want to start on any specific topic like PCOS versus endo? I mean, are they similar to treat or offer services, or what are your thoughts on that?
Yeah, so endometriosis is more about think it's more about immune dysregulation. Also, which then disrupts hormones, causes so much inflammation within the body. So it's focusing a lot on what is the things that are causing the inflammation. Sometimes it can be down to the diet. Some things like dairy can sometimes be a problem because of the same proteins that are within cow's milk. And just focusing on foods that are anti-inflammatory is one of the main things that we would focus on in that particular area. There's quite a big thing at the moment within like the nutrition space in terms of anti-inflammatory protocols, where we remove a lot of things from people's diet and then we gradually introduce them back in to see what it is that flares up endometriosis. So it's focusing a lot on, autoimmune conditions, the gut health as well, and supporting, the hormones, because you tend to see, high estrogen as well in women with endometriosis. So, when it comes to being like a health coach, so health coach and nutritionist can sometimes be slightly different because although a health coach focus on nutrition, we also focus on a number of different areas like sleep, stress, movement, all these different things that can impact your health as a whole. So even so, like things like that we would put in place to support if people are struggling in them specific areas, which then ultimately has a knock-on effect and helps them with their overall health too. But when it comes to PCOS is slightly different. PCOS is more to do with sort of, like insulin resistance in that type of thing. It does still cause inflammation. So we do still need to focus on that too. But it's about how we manage insulin resistance, your blood sugars, that type of thing, and looking at it from that angle.
I know this is
No,
so interesting. I'm like so intrigued by all of this. This is really cool. That's great.
yeah, I was gonna say because I don't know if you know Amanda's story, but she has lupus as a background, like as a chronic disease she's had for years. And she's recently just had the Emma Alice test, which came back and showed she had positive markers for endo. And that was after she had her son and then went on to have several losses. So this is just super interesting. I think maybe let's use Amanda as an example. Like for, for a client like Amanda, what type of services would you offer, or what type of advice could you offer somebody like that, or if our listeners are in the same boat?
Yes. So I generally worked with women through two services. So the first service being working with me on a 3-month basis, and this is where we really try to get to the nitty gritty and the root cause of what is going on. And because it's coaching, it's all about accountability too. So, I will give clients things that they need to go and put in place, and then, they report back to me like a week later, and we find out what's worked, what hasn't worked. We adjust things because things aren't straightforward all the time, are we? We have bumps in the road sometimes. You might have had a busy week, you might have had a stressful week, so sometimes that can sort of steer you off course. So with working with somebody for 3 months, you've got that accountability to get you back on track. And we would focus on all the specific areas, and as we go through them weeks, you'll be surprised what comes out. So like a lot of questioning that I will do with women, and they would then, the answers will then sort of be that sort of like golden nugget that will then say, right, okay, well, we now need to focus on this. We need to put maybe these foods in place, and maybe, some supplements that might be needed too, that type of thing. So that's the 3 month program. But but then I can also work with women on a 90-minute basis. So we have a 90-minute session, and we'll go through what's called a health or fertility history. I'll ask them again a lot of questions about things, and then I will then again provide them with recommendations based on what they've told me, for them to then take away and put in place themselves. So it's more, the difference between the two is more about, you've got somebody to handhold you on, for 3 months, or if you're that type of person who can just manage things and put things in place themselves, a 90-minute session might be the best one for you.
That's incredible. And is this something that anyone can reach out to you, or is it only like your country specifically, or can anyone reach out to you and be able to work with you?
Yeah, anybody. I've worked with people in the US. I've worked with people in Germany, across Europe. So yeah, it's I work across most countries.
That's
Do
amazing.
you Guys, do you notice a difference when you're working internationally of just like women's habits, or do you notice anything like that? I know like in the health world, I think internationally across the borders things are different, but would you say with fertility patients it's all pretty similar?
Yeah, I don't think I could say anything particular that stands out, whereby they're not. Obviously, the different healthcare systems that we have, you guys have like private healthcare, we don't, and so sometimes it can be easier for you guys to get certain things that you need, like blood tests and that type of thing. Whereas over in the UK, when you first go to the doctors, there'll only be certain blood tests you'll be able to get done. You won't necessarily get everything that I would recommend for somebody, so they end up having to pay privately. So there's like on the investigation side of things, it can be quite different. But when it comes down to the individual, there is pretty much the same.
That's awesome. And then I saw also on your website it was like a 5-step guide to preparing for pregnancy. That sounds like an amazing resource. So people can just go on and put their email address in to receive that. Is that right?
Yeah. So it's sort of like a step-by-step guide, just so for both men and women. because we can't forget the men as well.
Yep.
It's 50-50. So yeah, it just gives you a bit of a breakdown as to the types of foods to be eating, lifestyle changes to be putting in place. So there's that particular resource, and I've got other free resources as well on the links on my Instagram. So like a free ways to like how to understand your ovulation. Sometimes there's ones on there as well about hormones, the sort of like a troubleshooting guide onto, if the same symptoms you're experiencing, it could be these particular hormones that are affected, and then it sort of helps women then go down the route of doing a bit more investigation with their maybe doctors to see what's going on.
Yeah, that's your Instagram is incredible. I guess we didn't technically mention that. It's the
Yeah.
fertility coach
Yeah.
underscore. And it's super informative. I'm on there right now. And not only, I mean, some of your previous podcasts, like my mouth is on the floor with the one where you said your client walked into a doctor and they said to open the fridge and they were like, think about cake or baby. Like, what the heck? And so to have like a resource and a provider like you that can say like, no, like that's not the mindset, that's only going to like be more detrimental to that woman. I love that you share that. And then you share all of these things, which I think is so important. And I think maybe for our listeners to understand that like they can come to you they can likely come to you without a legitimate diagnosis, and you're going to do that investigation with them and work through things, because that's what your Instagram looks like. It's just extremely educational.
Yeah, so it's, as a health coach, I can't diagnose because that would be down to a doctor, but I can steer them down a route where they'll go, well, I'll say, okay, this is what's potentially happening. You might now need to go and speak to your GP about these particular things. So, it could be anything from like your thyroid as well. So if we see things when it comes to, we do a lot of tracking your temperatures, your BBT, it's called, of a morning. If that shows up and it's consistently low, that is an indicator that there's problems going on with your thyroid, which then ultimately impacts fertility. So, and then they get the diagnosis because they've been like sort of investigated a little bit more rather than just being left, I suppose, to do things on their own, their own research. So it's good in that way. But it's funny you say about the cake or baby story, because that was an actual client from New York. So she contacted me. She originally lived in Texas and had moved to New York, and then she contacted me because she was struggling with PCOS. And yeah, she's such a lovely woman, and she and the story. Yeah, unfortunately, she went to the doctors with her husband, and that was what was said to her, which is quite sad.
And it's like the exact opposite of what fertility issues are. It's like acting like the woman it's like her fault because she's eating a certain way, or like, no, I mean, it just was like blew my mind. So I love that you share, not only like your clients' experiences, but you touched on what I was going to go to next, is just kind of about like optimal ranges of hormones. And I think that standard, at least in the US, standard physicians will send you what we have is called LabCorp, is like typically where you get all your blood work done. And they shoot it over to you via email and it says it's normal, it's great. And I talked about it on a couple episodes a few weeks ago about just like thyroid or iron or progesterone. We just did a huge giveaway for vitamin D, and all of these ranges where you see normal versus optimal are so drastically different. I know Amanda experienced that with her last few transfers. I have friends that are telling me, yeah, my thyroid's 3.5. My doctor said it's great. And I'm like, okay, but you haven't gotten pregnant in 2 years. You already did touch on it, but can you go into depth a little bit just about more like optimal ranges of like maybe a handful of labs for patients to look at?
Okay, so I suppose when it comes to optimal, I probably can't remember them all off the top of my head, but
Of
there's
course.
one in particular that does stand out is, when I mentioned about thyroid, so TSH. So TSH, usually what they say is if it's at a 4.0, then, you're fine, okay? But fertility clinics, I know specifically fertility clinics in the UK, like to see TSH as 2.5 or 2.0. So if you go to the doctors, they're going to look at that, and if it comes back at 4, they're going to say, yeah, okay, you're fine. There's nothing that to worry about. But when it comes to fertility and trying to conceive, the ideal is 2 or 2.5, and that, like I say, that's what like IVF clinics here in the UK would prefer. So that's something that if that comes back, I then say, okay, right, what we need to do then is we need to optimize your thyroid, and we will put things in place to support the thyroid. So it could be different foods, it could be endocrine disruptors that we need to remove, all that type of thing. And what I do see as well, so with when it does come to bloods, is women not necessarily getting them done on the right day as well. So that can also impact, what is coming up with hormones. So it does. There's and then there's a big emphasis on AMH as well. If AMH is really really low, it's the first thing that is suggested to somebody is to go down the IVF route. And I think there's other things that you need to consider when it comes to that. So age does need to be considered. There's other things like you need to look at FSH levels, because if FSH is high, then again, that does indicate maybe poor ovarian reserve. So there's a number of things that you do have to look at, and we do want them optimal as well. So like when you said about vitamin D too, so I don't know, in certain parts of the US and definitely here in the UK, when it's winter, we don't get any vitamin D from being outside because of where the sun is. So we have to take a vitamin D supplement, and research does show that women conceive more so in the summer than they do in the winter, and that's for that reason, because we're outside more, we are getting more vitamin D. So there's so many different various, obviously, I don't know what I'm trying to say, but I suppose with doctors, and they do come out and say things like they are fine, but they're not optimal, and it's optimal that we want to go for. And on the men's side of things as well, so like with sperm quality as well. The thing with sperm is that a man will never ever be called infertile if he's still got one or two sperm, okay? Because that one sperm could do the trick. It might, if he's got zero sperm, then yes, he's most definitely infertile. But if he's got one or two, he's not. But even still, one or two is not great, is it? You do need a lot more. It's just going to make take longer, or and I do see that when it comes to things like morphology, and that morphology sometimes isn't even looked at. And again, that is something that we that's another mark of it, like number 4. If it's below 4, they don't really look at it in a lot of detail. I'm like, no, we need to do something about this.
Yeah, and it's from what I've heard and read, there's some podcasts going around just about endocrine disruptors being like plastic, right? Your cutting boards, your water bottles, and that having a direct impact on male fertility and the morphology of the sperm or the sperm count. So do you ever work with couples, or do you have the woman come to you and then find out that it's probably more so the man that needs the intervention?
Yeah, so I do work with couples as well. So during either the 3-month programs or the 90-minute sessions. But if a woman does come to me and we are working together, I will always say, has your partner been looked at? Has he had a sperm analysis done? Has he had his hormones tested? And if the answer is no, then that's the next action. The next action is, this needs to happen, because, it could be him that might be causing the infertility issues. So, or it could be both. So we need to tackle on both sides.
That's
And
amazing.
oh yeah, go ahead, Amanda.
No, you're good. Yeah, I was just saying that's awesome that you work with both of them, because obviously, like you said earlier too, I mean, it's 50-50. It does take both of them to make a baby. So yeah, for sure. That's awesome.
And it can be quite, for men, I think as well, it's, there's a lot more out there, I think, for women than there is for men when it comes to fertility. And men can sometimes not talk about it as much as women. So, it's given them that safe space to be able to open up a little bit as well and talk about it, and help themselves with some of the stuff I'll tell them to do.
That's great. I also just want to mention, because I just saw that you have, I guess it's like a little storefront where people can, besides you can book with you and obviously do your call for 90 minutes, and then also get on the wait list for your 3-month program. But you have different guides for purchase. And I just wanted to mention a couple, just so people know kind of what to look for too, if they like something that they hear and they want to go to your website to be able to find the guide. But you have preparing for IVF, boost your sperm quality, PCOS to pregnancy, unlock your fertility. You have different supplements, and then you also have a code for people to use if you wanted to purchase any supplements that are recommended. And so I just wanted to mention that because those are just great resources for people to be able to use.
Thank you. I think so. Like I know, fertility can be expensive when it comes to obviously all the treatments, the testing, and all that type of thing. So what I've tried to do is sort of, provide. Obviously, Instagram, my social media is there for everybody to learn things as well. But try and put things at different price points for people as well. So if they've got a guide there that can help them with, information to, food wise and specifically for IVF and lifestyle changes that could potentially help somebody as well if they can't do a 90-minute session or a 3-month program.
No, that's amazing. Thank you so much. I so appreciate everything you've shared. Is there anything you want to share with our listeners, just in specific, like to obviously PCOS or endometriosis, if they were just diagnosed?
Yeah, so I would just probably say is just sort of like keep an open mind in terms of, there is so much things that you can do to support both PCOS and endometriosis. If you have just been diagnosed, it's not, I probably want to say is if you give yourself that like 3 months, give yourself like a 3 to 6 month period of finding out what helps with PCOS, what helps with endometriosis, and put things in place. And don't feel like you're going to see something change overnight as well. Some of these things can take 3 to 6 months for changes to happen, but sometimes small changes can have a huge impact on your overall fertility. So it's not to like take them for granted, because in the long term, 3 to 6 months time, you'll start to see the benefits of like just simple things like drinking spearmint drinking spearmint tea, that type of thing when it comes to PCOS, or just and putting anti-inflammatory foods in your diet when it comes to endometriosis. Just simple little things like that can just work wonders.
And I think most of us that have been on this path of trying to have babies and trying to find the answers for years understand that like the egg starts to develop 90 days, like so 3 months, the egg's like starting to develop. So to your point exactly, if you make this change, it's been 4 weeks and you're like, I'm still not pregnant or it doesn't work, that egg was already developing and like into a mature egg to ovulate well before you made those changes. So I love that you just note like, give yourself the 90 days, give for whether that's for like endocrine disruptor changes, removing them from your house or your lifestyle or diet, or even supplements. I know like when Amanda and I were going through this, we would like get on CoQ10 or something, but they always recommend do it for 90 days before you even like look for any type of like improvement. So thanks for mentioning that as well.
Yeah, 100%. And it's like diet and lifestyle are like the layers of a cake, and supplements are like the sprinkles on top of the cake. And that's what I always say, because I know women on this journey have a habit of taking every supplement that they can possibly find that's going to help, and I can understand that. But it's about targeted supplements, I always say as well, and for particular things. But
That's
lifestyle change.
That's such a good point, because I think a lot of people too, or at least in the US, maybe not as much in the UK, but high intensity training was such a fad in the US for so long, and myself included, like would be going to these 60-minute like HIIT classes and then like popping my supplements and trying to eat healthy, but then I wasn't getting enough food. And so it sounds like everything you're saying, it's just like interwoven, it's balance, it's layers, and it's also so personalized. And so I think that's why it's so awesome what you do is working with these clients, getting that health history, and then personalizing it to them. Because maybe for Amanda, she can go to a 60-minute HIIT class and it's not a problem. But maybe for me, that might be jacking up my thyroid or messing up like certain things in my body. So you offer so many great resources. And I think just your Instagram, like you said, as a whole is such a free resource, and it's so educational. I love it.
Thank you so much.
Well, I'm just gonna say it again. Your Instagram is the fertility coach _. And like Kat mentioned, I mean, the amount of reels that you do, we gotta give it to you. It's amazing. And you have, like she said, you have so many resources and it's so educational. So definitely check that out. And then you can get on the wait list for the 3-month program or schedule a call for 90 minutes with you as well. So thank you so much, Alex, for being with us.
Well, thank you for having me.